Yene Dr. George Haram is better than Komakakra. Yebe sports, Dan Quickly, one in Amha baby. Yebe didn't come on. Nah, it's saying. Oh, for me. Edem. Bam bam bam. Yana po missing them. Yana juma yemo. Yana mo friend yemo. Ewazinina yadanwo. Yanko. Sansabwa maya sansabwa. Ngrofa manswa nibichino. Say it beto. Say it besho. Say it bondumo. Nina. We're talking our prostate health this morning, and we have an expert, a urologist and minimally invasive surgeon, Dr. George Haramis, from the Luca Health Medical Specialty Center in East Legon. Only say Bema dear prostate here. The last one before we speak to Dr. George at base. Adam, that beautiful song by Dinah Hamilton, bringing the time to just about 7:30. Peace 1043. We normally have Luca Health every now and again in the studio, and this morning I have my good friend Dr. George Haramis. He's a urologist and a minimally invasive surgeon at the Luca Health Medical Specialty Center out here at East Legon. This morning we're talking on prostate. Men. Good morning, Dr. George.
Good morning.
How are you?
I'm fine. It's always a pleasure being here with you.
Thank you. It's always a pleasure to have you too. And let's dig straight into your area of specialty. Now, what exactly is prostate, and why is it important when it comes to the health of men or men's health?
Well, a prostate is a small gland.
A small gland?
It's a small gland. Imagine the size of a walnut.
Okay.
It is located just immediately below the urinary bladder. And the urethra, which is the tube where the urine is coming out of our body, is passing through the prostate. The most important function of the prostate is to produce some secretions that help to liquefy and nourish the semen. So the biggest function of the prostate is that it is directly involved in the fertility process of a man. So you can understand how important that is.
Very important.
So as we grow older, of course, we have to encounter a series of different kind of diseases. And that's why this is one of the most common conditions that a man has to face during his life, a condition related with the prostate.
So it just has to do with growing older?
Yeah, as we grow older, things change in our body, and we have some hormonal changes compared to our youth. And this has, as a result, some changes in the structure of the prostate itself. Its size gets bigger, and sometimes also it is more prone to other conditions like prostate cancer or to infections. So Yeah, sure. As we grow older, we will, at some point, we will meet with one of those conditions in one way
So
or
what?
another.
It is normal that as you grow older as a man, your prostate gland will get bigger.
Yeah, that's for sure. It's
It
a
hap-
natural process. It's not a disease.
It is a natural process.
Exactly.
So it's not a disease if it's growing bigger.
No, it's not a disease. The difference is among men how fast this is happening.
Okay.
In certain persons, this process is very, very slow, so they don't even have any issues throughout their life. But in some others, they start to experience issues even from a young age, let's say 45, 50, 55. But as I mentioned before, the more we grow older, the chance to have one of the common diseases of the prostate is higher.
One of the most known diseases or one of the most known ailments of the prostate is prostate cancer. You mentioned it earlier. Now, are there screening methods? Is there a preventive way? What does one do? Advise us.
Okay, that's a great question. Actually, September is worldwide the awareness month of prostate cancer.
September.
Yeah,
Okay.
everywhere in the
Interesting.
world. So it's a very good chance that we have the opportunity to speak about that now. Of course, there are screening protocols, but the most important thing our listeners have to know is that prostate cancer doesn't cause symptoms. And
It doesn't cause any symptoms.
It doesn't cause any symptoms.
Wow. Now that is dangerous.
So exactly. In contrary to the prostate enlargement that causes symptoms most of the time, so the patients are aware of it, and that's why they usually go to the doctor. Prostate cancer doesn't cause any symptoms unless the disease spreads well beyond the borders of the organ.
That's dangerous.
So that is exactly why the screening protocol itself is of paramount importance for men, and this is a message that we need to pass to our listeners, that the only way to identify and diagnose it early and to have a very high chance to really cure it is to go to your doctor and make an early diagnosis, which means once a year it's very important to have an annual screening, which is something very simple. It's very fast. It's not going to take you too long. The doctor can do a clinical examination. It can ask for certain blood tests. It can even do an ultrasound scan. And with these three things, he can have a very good idea of your state, and he can immediately suspect the possibility if there is a chance for prostate. Even more so now here in Ghana. We know people of African origin that are at a higher risk.
Yes.
So we have to be even more sensitive in this issue, and we have to really tell to our men that definitely at the age of 50, we have to come at least once a year to our doctor to make our screening. It can really save your life, and it can make a whole difference to your life.
Let me have some clarity here. So the prostate gland itself, as you grow older, would get bigger.
Exactly.
It doesn't mean you have prostate cancer.
Absolutely. You're wrong. You're
Okay.
absolutely correct.
Now, how do you know it's getting bigger? What are the signs to look out for?
Okay, the prostate enlargement, as I said before, is a natural process. It's a benign condition. And I want to clarify the fact that if you have an enlarged prostate, it doesn't mean you're going to have a cancer. These are
Okay.
two completely distinct states in our prostate. Of course, they can even happen at the same time.
Okay.
Okay, that is also important why the doctor needs to check for both conditions every time he sees a patient in his clinic. So the enlargement itself doesn't mean so much. For example, a lot of patients come to my clinic with an ultrasound that says, "Oh, doctor, I have a very big prostate." The size itself doesn't mean anything. The most important thing is whether you have symptoms or not.
Yeah.
And people with enlarged prostate, they have a very, very clear-cut symptoms. For example, they have some difficulty passing the urine. They wake up, especially during nighttime, many times to go and empty their bladder. They even have a frequency during the day and urgency. They cannot postpone the urination when the time comes. So these are the most common symptoms that they do have. Okay, so immediately when we identify this kind of symptoms and when we see that the quality of life starts to change, because as we grow older, we consider that normal, which is not normal. And that's why we need to address this issue with a urologist, and the urologist will give us the right guidance, and it will tell us how we can treat this condition.
So somebody comes in and says, I don't know, I haven't checked my prostate gland in a long time. Take a look at it and tell me whether it's enlarged, whether it's cancerous, whether it's the potential of... What's the process? What do you do?
So the process, as I said before, is first of all, we take a medical history, very important. It's important to know whether somebody in the family had a previous prostate problem, either it was a cancer or a prostatic enlargement. And that also gives us an idea that we have to be a little bit more thorough, and we have to search a little bit deeper. It is very important to make a clinical examination. For us, it's very important to make a palpation of the prostate, to feel the consistency. Is it a smooth? Is it a hard prostate? That gives us a lot of information. It's also important to make this blood test called PSA. This is a prostate-specific antigen. This is an enzyme produced by the prostate itself. And it's very important to see every year how this PSA test is behaving, because even if it is in the so-called normal range, it doesn't mean that there's something else going on underneath. And as I said before, it's also very important to do an ultrasound scan, of course, to check the prostate size, but it's also very important to see how much urine remains in the bladder after that, because we might have the feeling that we empty our bladder well, but there's a very good chance that this doesn't happen.
And the enlarged prostate can cause all that.
Yeah, absolutely. And the more urine stays inside the bladder, that can cause a series of other issues later on. We can have repeated infections. We can even see blood in our urine. Or in the most neglected case, we might say, we can even have a renal function compromise, or we can even have a retention. Very common here in Ghana. A lot of people, they found out they have a prostate problem when they are not able to pass the urine at all, and they end up in a clinic and they put a catheter on them. So a big number of patients they stay with a catheter for long because they're afraid to deal with that. And
so it simply means that we don't check the prostate often in this country, do we?
Honestly, yeah. I don't think we have the culture of screening that we see in other countries. And that is a very good opportunity now that we make this discussion to try to motivate people to seek for a medical checkup once a year. This is once a year. It doesn't have to be every 2-3 months. It's just one day a year that we can spend our time with our doctor. It's also important always to have a urologist that knows your medical history, so he can understand even slight changes from one year to the other. So yeah, usually we don't go here in Ghana so much. I didn't see men, very few men, they go to see.
Unfortunately. Now, when we talk about the enlarged prostate, what are the treatment options? A lot of us are afraid, to come to the hospital and be told this is what has happened. What are the treatment options? Is it curable? Is it treatable? Is it manageable? What exactly is it?
First of all, we have to make clear to all men that listens to us that this is a treatable situation, the enlargement of the prostate.
It's treatable
in one way or another. And usually our first step is for people who do have symptoms is to give them some medical treatment. And for many people, medical treatment is enough. For the rest of their life, they can take a medication that can really help them to pass the urine easily, and that's it. So for those people that the medication fails to improve their symptoms and their quality of life, then of course in this case we have to consider a surgical option. And we are privileged to say that at Luca Health we have the chance to provide a surgical treatment that it is minimally invasive. Minimally invasive means without cuts, without incisions. And it's an endoscopic procedure. It means a scope goes through the urethra, and the technique is called plasma vaporization of the prostate. And as the term states, we have a special scope that can vaporize the tissue that is causing the obstruction to the passage of the urine.
That makes urine free flow.
Exactly. But most importantly, it's that this scope can at the same time also coagulate the tissue, because most people are afraid of these operations because they know that usually these are bleeding operations, and they have heard a lot of stories of having a bleeding operation that requires a long time hospitalization, and they're very much afraid of that. With this technique, this is just now an ambulatory procedure. It means that if everything goes smoothly, the patient can do the operation in the morning, and the same day he can return back home. And I think that makes a huge difference, because the less you stay in a hospital, the less prone you are to all these perioperative complications like a pneumonia, like all these complications that you might have when you stay for long to a hospital. And to come back to this important thing about bleeding is that we don't need units of blood to be there.
You don't?
Because the procedure is very well controlled with the plasma vaporization, and we don't ask for blood units in advance, and that's why we're so confident that the patient can return back home the very, very same day.
Let me go into an area that is the subject of gossip. How true is it that the more sex you have, or as many times as you ejaculate, it makes your prostate gland healthy? I'm sure you've heard that.
Oh, of course.
We've heard things about a man has to ejaculate 21 times a month. And that
very good, huh? You learn a lot, you read a lot.
Well, I just happen to read that you have to ejaculate 21 times a month at least to keep your prostate gland healthy. Is it true, or is it just myth?
No, it's absolutely truth. Actually, there is a big study done by Harvard University a few years back that spoke about this draining of the prostate as soon as possible. In the past, the urologists in the past used to say, when you have a condition like that, try to avoid sex. Now it's completely different. We have changed this approach. We know that, as I said before, the prostate is a gland. It's continuously secreting its secretion, so this needs to be drained. The more this secretion stay inside the prostate, they are more prone to infections.
Really?
So it is true. I mean, sex, first of all, is a natural process. It's not something that it has to be done because it needs to be done. It's a natural process.
It comes naturally to people.
Exactly.
Yes.
So it needs to happen, and it really helps in many cases to drain the prostate secretion. So yes, you're absolutely right. We know that. That is a fact now.
And how true is it that it should be 21 times a month at least?
Okay, that it depends, I think, on every single man. But definitely, the more you do, it's normal. I mean, to do 10, 15 times per month, I think it's normal.
It drains your prostate gland.
Exactly.
And so it helps to keep your prostate gland healthy.
Healthy. That's true.
Well, Dr. George says, license to shoot. Ha. Anyway, so now that we've gotten that out of the way, give us tips. How do you keep your prostate gland healthy? We've just talked about having frequent sex, but how do you keep it healthy? Any tips?
Well, the prostate is a very interesting organ. It really follows our lifestyle and the way we live. So whatever makes our life healthier, it has a very positive effect on the prostate as well. Just to give you an example, for example, to control our body weight is very important. We know that overweight people, they're more prone, let's say, to some infections in the prostate and even prostate cancer. We know obese people have more aggressive type of prostate cancer.
I see.
So checking our weight is very important. Also, our diet is very, very important. We know from many studies that when we try to adopt this Western type of diet with a lot of red meats and all that, we see an increase in the incidence of prostate cancer. So we need a balanced diet with a lot of fruits, with vegetables, and try to minimize the red meat, because we know there are substances in the red meat that are involved in the carcinogenesis in the prostate. So that is very, very important. Also, making a lot of physical activity. We know people that they have a regular physical activity, and when I say physical activity, I don't say that you have to run like a marathon every week, but if you do walk, for example, 3 or 4 times per week for 30 minutes, which is something that can be done, that also has a positive impact on the prostate. And also smoking, important. We know people that have stopped smoking, also they increase their chance to have a much healthier prostate. So everything related to a balanced lifestyle has a positive effect on the prostate for sure. And also certain foods are very helpful. We know tomato, for example, cooked tomato is very important. It has this substance called lycopene. The lycopene is very good because it protects the prostate, for example, for developing cancer. So we have to adopt a healthy lifestyle, and that will definitely have a positive outcome to our prostate.
Interesting. We're having a conversation with Dr. George Hiram. Is from the Luca Health Medical Specialty Center, and this morning we're discussing prostate health. All men listen, all women listen too. So, any more information about the prostate and Luca Health and what you do, please?
Okay, so Luca Health is a multi-specialty center, and we're a great team of people with a lot of experience. We bring a lot of experience from different places, from the US, from Europe, even from Ghana. And we have, except from me, we have also a general surgeon, an ENT doctor, We also have a gynecologist, internal medicine doctor. Recently, we're joined also by an excellent cardiologist as well. And we keep expanding. We also have an interventional radiologist, physician assistant, which is very experienced. He can get all types of biopsies, and it can even help oncology patients by doing thoracocentesis or putting ports to them. People who do chemotherapies and they have a hard time getting an IV line because of these treatments, we can have a permanent port that will really help their condition. So in general, we're a team that works together. We work there. We don't work in another place, so we're always there. People can find us at East Legon.
Yes.
We are at the MDS campus in Maseru Road 27, just behind the Mensvik Hotel. And we work from Monday to Friday from 8 o'clock to 5 p.m. And for those who want to make a contact and book an appointment with us, they can call our telephone center, which is 0544 120 777.
Come again.
So it's 0544 120 777. And we'll be more than happy to meet them. And we're pretty confident that we can provide top-notch, I think, medical services. And it will be a pleasure to have everybody there.
Yes, of course. So there we go with Dr. George Haramis from the Luca Health Medical Specialty Center in East Legon. This morning we've been talking about men's health. In fact, prostate health. Prostate. Keep it healthy. But for those of you who want a little sensational conversation, at least 21 times a month. Hey, that's a lot of work. Anyway, he says no, at least average 10 to 15 a month is not a bad idea. Dr. George, thank you very much for your time this morning.
Thank you so much for having me.
Great.
Have a good day.
Have a good one too. Peace 104.3 Twi Jimmy Diano Soul.
FM.
Kokrokoo live in your ear. Yeah, man. Yeah. Yeah, uncle.
Okay. Peace FM.
And somebody says, Chairman General, if you know shoot or die, be die. So shoot, do or die. Silly. And somebody's 6 years old today. April Zendaya Chinibua Boating. Happy 6th birthday to you, April Zendaya Chinwa Boating of Royal Streams International School. It's from your darling mother, Nane Fua, your dad, Kwame, and the entire family. We love you, April. God richly bless you. And it says, sending smiles your way. A day full of pleasant surprises. Happy birthday to you, Love Adiama of MTN Ghana. Enjoy your birthday, Love Adiama. It's from HB, Nuna Enam and Martina Kanyi of Absa Bank, Accra High Street. Bless you, love. A belated one to you, Na Tete Kwa the First. Na Tete Hoko the First, Glefe Manya. It's from Rafa Kwe, Emma Eunice and Rita Ankara. All of the Holy Trinity Cathedral Church, High Street, Accra. And it says a belated birthday wish to my big sister Grace Ochiribuating, aka Mana. It's from your sweet Asabia and her boys to you, Grace Ochiribuating. Pump it, baby, oh yeah, Jima. 1, 2, you know Dama be sushi. Oh yeah, Jima for Jabi. And Chebia Dan Kwekwe Wabeba. A belated birthday wish you, Dr. William Safo, Deputy Director of Finance, Ghana Communication Technology University. And also to you, Nana Benne, aka Nana Bodem of Siga Technology, and Thomas Atople, aka Tomaszewicz. It's from UGBS 2000 Club, 2,000 members and executives. Lieutenant Kenneth Abba Amachi, good morning to you. Oh yeah, And shouting out to you, Mrs. Akusia Buahin of Prudential Bank. You have a lovely day. I will lift up your day. Mama Lydia will Kanshin, and I would happy birthday to Mama Lydia of Kanshin. From all your loved ones and Agatha of Neat Foods. Lieutenant Akusia Buama, good morning. Have a beautiful listening time. And to you, Professor Babuating, have a lovely day, Prof. Ohineba Kisi Dakwa, aka Bravo. And to you, Godfrey, the name of Tessano Police Station. It's all from Wolanyo and Akwetia. It says, please wish my friend and brother Yao Bio Yintumi Mensa happy birthday to Yao Bio Yintumi Mensa of the Forestry Commission. It's from Goodfellow to you. Vida AC Kwaku of Victory Bible Church International. Enjoy. Ba, ba, ba. De, 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 de. Joy. Yeah. Joy like a river. Ifwa Barry, good morning. It says, please wish Uswe J. Boma Nesri B of Our Lady of Holy Cross School in Kaswa and class teacher Rita Addison happy birthday from Nana One in Kaswa and your parents, Mr. and Mrs. Boama. Ivy at Champong Ando, happy birthday to you, Ivy at Champong Ando. It's from your husband Richmond and the Nyako family.